Hello, I've come with a topic that has been an enigma most of the time, that is sleep. Nobody has been really able to decode it. How a good sleep happens, why sleeplessness happens, why some people sleep more and some people less. But there is an agreement to the fact that a beauty sleep really rejuvenates you and it's a blessing. So let us try to decode sleep a bit. We know that sleep, it's not about the number of hours but the quality of sleep that matters. And we know that the sleep passes through two cycles, that is a non rapid eye movement, that is NREM sleep, followed by the REM sleep, which goes in cycles of 90 minutes, and 4 to 5 cycles on an average happen in a night. So, a non-REM sleep is when your muscles relax, the heart slows down, the respiration slows down. So, practically every muscle and every visceral organ takes rest during that time, and probably all the regeneration and rejuvenation happens during that time, and which is followed by a REM sleep, that is rapid eye movement sleep, when the dreams happen, the nightmares happen. So, we know that these sleep cycles keep happening 4 to 5 times during a particular night, and all the regeneration activities of the cells happen during sleep. So, a good sleep is imperative for good health. It controls the immunity, controls the hormonal system, it is the excellent stress buster. It offers you some protection against lifestyle diseases, etc. So, what are the keys to having a good sleep, good night's sleep? A couple of things are, we know there is a gland in the brain called the pineal gland, which is the crucial gland as far as sleep is concerned, and there is a hormone called melatonin, which controls. We know that melatonin is available in the form of buccal sprays and tablets nowadays to regulate the sleep, especially when the people are jet lagged and they move from one time zone to another area. So, this is regarding some brain control of the sleep. But there are a lot of things we can also do to get a good sleep. One thing we stress on is sleep hygiene. We know that that is something we can do about getting us good sleep. One thing is, don't use the bed or the area where you sleep for anything else. Don't use it for working, don't use it for relaxing, use it only for sleeping. Keep other areas for working. Bed is only for sleeping. So that's the message the brain gets when you go to lie down or go for a good night's sleep. And a couple of things are, we are facing great challenges with the blue light. We know that television, the computers, the mobiles, they emit something that is known as the blue light. This blue light seriously affects the secretion of melatonin, and there is a close association between sleep and blue light. So, it's ideal to cut down blue light a few hours before you go to bed. That is, stop using mobiles a while before you go to sleep, at least an hour or so, and don't be searching for plug points to plug in your mobile, or there is a saying that olden days we used to sleep under the sky and look at the stars, but now we search for plug points where a mobile can be safely plugged in. So, let us go back, if not into these stars and moon era, let us at least keep the mobile away while sleeping, at least an hour and a half before you go to bed. A cup of warm milk may help. A good bath or a good shower before going to bed may help. Keeping your worries aside, a bit easier said than done, but that can help. So, these are a couple of things one can do in order to have a good night's sleep. And we always know that whenever you think, I couldn't sleep last 3 nights, and we are very anxious about not getting sleep evades us. So if you are not sleeping for a couple of days, it's okay. That happens for every normal human being. You may sleep on the third or fourth day, but if it goes on for a week and more, it affects your daily routine. It's making you groggy and sleeping during the daytime. Well, you need to address the problem and go to a sleep specialist, a neurologist, or a physician. So, what are the issues or diseases concerned with sleep? We know that obstructive sleep apnea is something which we very commonly encounter now, and which we know that is also causative in various lifestyle diseases like an uncontrolled hypertension. It adds to the risk of a stroke, etc. Obstructive sleep apnea is closing of the airways when you lie down flat, and you may get spells of apnea, that is absolutely no breathing, and you may wake up with those symptoms, and the next day you will be absolutely sleepy. You may go off to sleep while talking, you may go off to sleep while driving, which can be dangerous, and even when you are indulging in an interesting activity, you may go off to sleep. So, these are a few criteria to diagnose obstructive sleep apnea, and it is diagnosed by something called a sleep study or polysomnogram, which shows how many times it happens. The test happens during sleep. So, it will show you how many episodes of apnea you have been having, those episodes of apnea have been lasting for how long, etc. So, if you are excessively sleepy during daytime, and you have attacks of getting up in between nighttime sleep, you don't wake up fresh, well, one must look for obstructive sleep apnea, and the major risk factor is obesity and a short neck and some factors which are there in the upper airways, a blocked nose, a large enlarged tonsils, etc. So, have a ENT checkup, undergo a polysomnogram, and find out. It can be easily correctable by using a BiPAP machine which helps you breathe during sleep. So, this is one problem related to sleep. Then there is sleepwalking, that is called somnambulism. Many people suffer from it. Then there is narcolepsy, excessive sleep, sleep paralysis, which many of us would have experienced after getting up from sleep. We are awake, but none of our muscles would move for a while. That is sleep paralysis, that's normal at times. Then you have a restless leg syndrome, wherein you have a tingling sensation or an abnormal sensation creeping on your legs, and you can get rid of that sensation only if you get up and walk a bit. So, that also deteriorates or creates a lot of trouble in a good sleep. So, these are a few diseases or few problems associated with sleep. So, some of these problems, well, one needs to address through medications. Some problems can be circumvented by using a good sleep hygiene. But having said all this, the key stress or the most important factor that one should take care of is avoiding devices emitting blue light at least an hour or two before going off to sleep, and maintain a good sleep hygiene and reserve your place of sleep only for sleeping. So, wishing you a good night's sleep.